This is my audience: Jesus Romero, Jessica Hutchison, Deanne Romero, and my children. They say a healthy baby is a happy baby. And did you know you could accomplish both of those things by simply breastfeeding? I know that most people want the best for the children at the start of their life, and I wanted that, which is why I chose to breastfeed my children also. Breastfeeding has many benefits that include health for the infant, the bond between the mother and child, and then added health benefits for the mother herself. First, I'll start off by telling you about the health benefits for the child. The American Pregnancy Association says that breast milk is the most beneficial nutrient that an infant can have. That's because it's the perfect combination of fats, proteins, vitamins, and carbohydrates. Breast milk is specifically designed by the mother's body for each individual child. It starts out as colostrum. As you can see in this bag is a more yellow breast milk, and then as the baby ages it turns to regular breast milk, which is whiter. It's more yellow because it's packed with the nutrients, more leukocytes and antibodies for the newborn to start its life, and then it turns to a more well-rounded, balanced breast milk, and that's why it's lighter in color. The breast milk actually changes as a child is sick. When a nursling is put up to the mother's breast and it's ill, the mother's body triggers a change in the breast milk to add more nutrients and more of the infection-fighting agents so that the baby heals quicker. Not only does the breast milk help the babies that are sick get well, it also helps to prevent many diseases and illnesses that include colds, serious ear, nose, and throat infections. It helps lower the risk of lower respiratory infections. It helps fight off obesity in the child. It helps them prevent getting things like allergies and asthma, and it helps build their jaw and facial muscles better. Not only does it prevent those diseases, it also really prevents sudden infant death syndrome. There's a 36% less likely chance that a baby will die from SIDS if it breastfeeds, and the American Pediatric Academy says that if 90% of mothers in the United States could breastfeed their children for 6 months or more, we would save 900 lives in the U.S. alone every year. So not only is breastfeeding beneficial to the child's health, it really also helps the mother and the baby bond better. The baby feels a better bond from the mother because it's feeling safe, secure, and loved while its most basic needs are being met. The baby is getting constant eye contact and skin contact, which makes it feel like it's really connecting to the mother. Breastfeeding promotes skin-to-skin contact, which has been proven to significantly develop a baby's brain more, because babies are happier, they have less stress, they cry less often, and that all promotes better sleeping. When the baby sleeps, that's when its brain develops, so better and more sleeping promotes the better brain development. With brain development, it is not necessarily scientifically proven, but there is a direct link between IQ and breastfeeding. This right here is a little chart that shows average IQ between a New Zealand group and then a British group. It's kept the steady mean as a genotype to prove that it is not genetically something that the children are getting, and then the differences are not breastfed in blue dots and breastfed in pink dots, and it shows you that in every single one of these categories except for one, breastfed babies have an average higher IQ than formula-fed babies. Now, like I said, that is not necessarily scientifically proven, but if it's an opportunity for you to make your child smarter just by breastfeeding, I'm sure that's something that we all would want. Yes. So, not only does it develop the baby's bond with the mother better, it also makes the mother's bond with the baby better. Breastfeeding releases hormones that trigger more maternal instincts in the mother, and breastfeeding can help to decrease postpartum depression, and if the mother already suffered from depression, breastfeeding helps to curb the side effects that the baby would feel from the mother's depression. Mothers who breastfeed are also able to pick up on cues from their babies a lot better. They are able to distinguish a cry for hunger versus a cry for a dirty diaper. They're able to know when their baby is full and satisfied so that the baby does not overeat as often. So, breastfeeding has clear benefits between the bond of mother and baby, and it also benefits the mother's health. Mothers who breastfeed are more likely to heal quicker, They heal quicker because breastfeeding releases oxytocin, and oxytocin causes your uterus to contract, which makes it shrink in size and go back to normal a whole lot faster. When it does that, it also decreases the amount of postpartum bleeding that the mother has. Mothers will also see themselves returning to their pre-pregnancy weight a lot faster because they're just burning a whole lot more calories by feeding their baby. Mothers also see a decrease in likelihood of illnesses. The La Leche League International says that women who breastfeed for 6 to 24 months will be 11 to 25% less likely to have breast cancer. A woman who has breastfed for any period of time will have a less likelihood of having ovarian cancer, but if a woman is able to breastfeed for 31 months of her life, it does not have to be simultaneously, it's just over all her children, she will see a 90% less chance of getting ovarian cancer. Also, women that are able to breastfeed for 1 year or more have a decreased chance of getting high blood pressure, high cholesterol, developing type 2 diabetes, or having cardio problems like heart disease and heart attacks. So the benefits for the mother's health are just as beneficial as they are for the child's health. Now I'll just do a quick recap of the benefits of breastfeeding. It benefits the baby's health and the baby's immune system. It builds a stronger, more connected bond with the baby and the child, the mother, and then there's complete amazing benefits for the mother's health. I personally think that breastfeeding is the most natural, healthy way to feed and nourish your child, and I will not argue that a fed baby is the best baby, but if you have an option between artificial feeding and breastfeeding, breast is the best all the way. Thank you. And then this is my audience still: Jesus, Jessica, and Deanne, and then my children.